This is LiveWell Talk on New Clinician Spotlight. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health, St. Luke's Hospital. Today's episode is another installment of a series on the podcast where we sit down with new clinicians at UnityPoint Health, Cedar Rapids, and get to know them as a clinician and as a person. Our guest on today's episode is Allison Cadden, a physician assistant with UnityPoint Family Medicine at Northridge. Allison, welcome to the podcast.
Hello, thanks for having me.
So tell us a little bit about yourself. Where are you from?
I'm from Eden Prairie, Minnesota, right around the Twin Cities. I grew up there my whole life, and then I went to college here in Iowa at Iowa State University, so I'm a Cyclone, even though I know we're in Hawkeye territory.
Oh, yeah, that's bad.
I know, but I'm used to house divided. My dad and my brothers are Hawkeye fans, and me and my mom both went to Iowa State, so I'm kind of used to it, right?
I think if you went to Iowa State, you kind of get a dispensation for not being a Hawkeye fan, right? Mm-hmm. I mean, you went there. You're an alumni. It's not like you chose to be an Iowa State fan. Anyway, well, if you want to build a practice, you can always lie that you like the Hawkeyes. So. Do you have family?
Yes, I do. So most of my family is located still in Minnesota, but my dad grew up in Grinnell, Iowa. Oh. So I have the connection to Iowa. My aunt and uncle live here in Iowa also. My mom's also from Iowa, from Clear Lake. So I have a lot of family in Iowa.
You got a lot of Iowa ties,
yes,
don't you?
Lots.
I practiced in Grinnell for 5.5 years, right out of training in the late 90s, early 2000s. Great town. Well, take us through your education. You went to Iowa State for undergrad.
Yep.
And where'd you acquire your physician's assistant degree from?
I went to University of Wisconsin-La Crosse. So I went there right after graduating, like 2-week break from graduating at Iowa State with my bachelor's in biology. And then went straight into my master's of physician assistant studies at La Crosse, where we do like a year of didactic training. And then we do 2 weeks at the Mayo Clinic to learn like our clinical skills, like how to suture, how to scrub in, all that kind of like fun stuff. And then I did my clinical year with the Marshfield Health System all over Wisconsin. So I was kind of all over the state of Wisconsin.
Cool. What brought you to UnityPoint Health other than these world famous podcasts?
Yes. So
beyond that.
Yeah. So I knew kind of all throughout my clinical year that I was going to be moving to Cedar Rapids. My significant other, who I met at Iowa State my freshman year, we've been dating all throughout like undergrad and PA school, so I kind of knew when he had the job here that I was going to kind of follow him. So I kind of always knew I was going to come here.
Okay. Well, we're glad to have you. During your training was there a particular aspect of medicine that you enjoy more than others? I mean, you've chosen primary care.
Yep.
You work out at Northridge, great clinic.
Yes.
Jenny Beck, awesome.
Yes.
She was my medical student. That's how old I am. And she was a resident here in Cedar Rapids. Mm-hmm. One of the first classes when I moved back to town in 2005. So she's been in practice a long time. But what is there an aspect of care that you enjoy more than others?
Yeah, it's definitely the part of the reason why I went to like family medicine is like building that relationship.
Yeah.
Yeah, you get that relationship.
Best part of medicine is the relationships.
It is the best part of medicine.
And for me, as getting older and looking back at my career, yes, that's the best part of medicine.
Yeah, I 100% agree. And like that's like the moments that fill your cup up and like keep you going. So I kind of always knew that I wanted to have those relationships with patients. In family medicine, you really get that. You get that every single year, or even, I've been at UnityPoint practicing for roughly like 7 months, and I already have patients where, you've seen them more than once and you're following along, or you're seeing them, you're getting their office visits from other specialties, and you're keeping up on everything. So you really build that relationship, and that's like definitely the best part. And clinical rotations, it was even like when you got to see someone for like a 2-week follow-up when I was in family medicine, and you got to see that you changed a medication and they're doing better. There's no better feeling than seeing someone doing better from like something that you recommended. Like that's the best feeling in the whole world. And all my rotations, I liked things in every rotation. So then it's like, well, if you like things in every rotation, then family medicine's kind of perfect because you get to see everything. So
that's funny that you say that, because Dr. Mike McCleary and I were residents together. So this is the early 90s, mid 90s, and we would moonlight like in ERs around the state, and you always thought you were brilliant because all your patients got better, right? Because you never saw them back. And then you graduate and you actually get in practice and you're like, oh, so patients have to come back, And so, no, that is so true. And it's so, those relationships really, really are fun. Mm-hmm. They really are. And they really make it worthwhile. You're right. That's my why, of why I keep doing this. Did anything specifically do at UnityPoint Health?
Yeah, as you talked about Dr. Beck and like everyone at UnityPoint, once I did like my on-site interview, it was like really getting to meet the team that really made it. Like I knew I wanted to work there. I wanted to work with them. I mean, as a new grad physician assistant, the PA model is built on teamwork in the healthcare system, and so much about healthcare is teamwork. And I really wanted to make sure I was with a really good team, and that team there is amazing. Dr. Beck, who's my integration coach, is just the most amazing physician.
Yeah, she is.
Like someone I look up and respect so much. All the nursing staff and especially from the experienced specialists all the way, to certified medical assistants, to the nurses, to the other PAs, to Dr. Ray and Dr. Beck. Like that whole team there is just amazing, and I knew I wanted to work with them.
Yeah, Brian's got to be getting really close to 20 years in town. Mm-hmm. Very close. Really close. He's got to be very close to that. I remember when he started, and he's a great clinician too. He's taking care of mutual patients. He does a nice job. How could I best describe you to your patients or potentially new patients?
Yeah, I try to think try to be very empathetic, try to be a listening ear. I mean, I think in medicine that so much of it is like listening to figure out what's going on, right? Being able to ask the right questions and listen and like truly see what's going on. And, sometimes you have to read behind, like in between the lines too, to see what's really going on. So I try really hard to listen and, try to be there for patients, right? Sometimes, someone needs you more to listen. Sometimes someone needs you to be a little bit more bubbly and try to lift the spirit. So I try my hardest, to be there for what patients need in that moment, because that changes over time in what they're going through.
That's important that you've said this, and that lends a lot of respect that I have to you, or that for a younger clinician, that you understand that, because it does change over time. Patients, you either have a fraternal relationship with a patient, you're a brother and you want to make decisions together, right? Mm-hmm. Or paternal, where they want the decisions made for you or made for them, right? Mm-hmm. Or they want you to have that paternal relationship. And the patient, that varies. Mm-hmm. And you have to sense where that patient's at in their healthcare journey, where they want someone to be with them to help make those decisions. And other times when they just want someone to tell them what to do, right? Or just tell them what medicine to take. That's you're wise beyond your years to understand that, and that's a quality that you can't teach. So good job. What we talked about the kind of the generality of the relationships, but is there like diabetes, hypertension? What kind of, is there an aspect of care that you enjoy doing?
Yeah,
more than others.
I love women's health. I think that field is constantly changing, and it's, always awesome to be there for someone and talk about that side, especially as a woman myself. Also, I did research in Parkinson's disease at Iowa State in undergrad. So
really?
Yeah. So at the neurophysiology lab, I did research on how virtual yoga, because that was like right around COVID time, how virtual yoga affects motor symptoms in Parkinson's disease patients. So Parkinson's has a big, and any neuromuscular disease has a big place in my heart.
Have you had the opportunity to care for one with the brain stimulator yet?
No, I haven't. In my clinical
that is so cool.
It is really cool. I know. On my clinical rotation, I actually did a neurosurgery rotation, but they didn't have any. I've helped replace the battery for one, but I never got to see the actual procedure. But it is fascinating.
I've had one. Mm-hmm. It was a hip fracture I took care of here in the hospital. I believe the guy was from Manchester, I think. North of here a little bit. Not too far. I think it was Manchester. Could have been Independence. But anyway, that was so cool. He turned that on and the tremor went away. That was amazing.
Yeah.
So you got to do a change of battery?
Yeah. I got to change a battery, which was still really cool. But yeah, they knew in neurosurgery that was a special interest of mine. So it was cool to be able to see that.
Yeah. Yeah, that is, I was amazed. I mean, that was amazing. and really makes you appreciate how technology. First of all, Parkinson's is an easy disease to treat early on because they respond to the Cinemet and, this is great. But it becomes so hard to treat later. And this is such a wonderful option for patients that, we probably should do a podcast on those neurostimulators. Thank you.
Yeah.
Might even have you back to do that with your background in that. Well, we've kind of heard what you like to do in the clinic and what motivates you every day. What do you do for fun?
Yeah, I love reading. That's probably like my favorite thing to do is I love reading. And last weekend was independent bookstore day. So I went out to the independent bookstores around town to get some more books. I also love walking and sewing. I recently took up sewing. Yes.
So so you like to sew, like clothes?
Yeah, clothes or bags, like tote bags. Yeah.
What's the difference between sewing and knitting?
Knitting is like when you're using, which I don't knit, so no one get mad at me for not really knowing necessarily the difference. But knitting's like you're using your hands and you have like the yarn. Where sewing, you can hand sew, but I use like a sewing machine where you're like taking fabric and then you're running it through a machine.
Okay, what's crocheting then?
Crocheting, I believe, is like more when you have like a special type of fabric and then you are like you have like a brace and then you're doing more intricate like needlework. Yeah. More like
what is it called when you have those round things and you like it's like a pattern?
That's like embroidering and crocheting.
Embroidering. Okay.
I believe.
All right. See, I get fixated.
I'm not an expert on that.
No, I told you before we started today that I get fixated on things like that, and thank you. You did great. I mean, you're like, this is what it is. I'm impressed.
I'm trying.
I'm impressed.
At least my like basic understanding. I could be totally wrong though, so I would want to.
Okay, we won't hold you to it.
Would want to check.
No, I'm impressed.
On that one.
I'm impressed. You had just for the listeners, there was no prep ahead of time. She completely answered those questions on the fly. So impressive. What is a fun fact about you? You'd like the patients to know and listeners to know?
My fun fact is I danced in the Super Bowl halftime show in 2018 with Justin Timberlake.
Seriously?
Yeah.
Okay. How did that happen?
Yeah, that was my senior year of high school, and I was on my high school dance team, and somehow they reached out to us and asked like all the Twin Cities, like suburbs of the dance teams, if we would want to be background dancers. And of course we all said yes, because who wouldn't want to do that? And so then for like a couple months leading up, after we would have dance practice at night, we'd get bused to like the state fairgrounds in Minnesota and practice. And then we'd practice in the stadium for the couple weeks leading up. And then on the big day, we did it.
I'm at a loss. I mean, you had the advantage here. Where was the Super Bowl that year?
Yeah, Minneapolis.
Okay. Yep. So that's why I always wondered, how do they get those background dances? Now I know they kind of look for the local talent. Who played in the Super Bowl that year?
That was the Eagles versus the Patriots. It was the Eagles' first Super Bowl win.
Wow.
Yeah.
Nice.
Yeah.
That is impressive.
Yeah.
Yeah, I can't remember. I can remember who played in the Super Bowl this year, but it's lucky if I can remember who did the year before, or what my kids' names are. So that's impressive. I'm impressed.
Thank you.
Allison, thank you for joining me. It was fun to get to know you and to hear about your interesting life journey, really, and kind of that Super Bowl. I'm just so impressed. That's so cool.
Thank you.
Once again, this was Allison Cadden, a physician assistant with UnityPoint Clinic Family Medicine, Northridge. If you'd like to schedule an appointment with Allison, call UnityPoint Clinic Family Medicine, Northridge at 319-393-0783. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.